Hello everyone and welcome. In this video, we will be discussing regarding a few questions that have been asked around the topic of diabetic retinopathy. So the first one is ophthalmic complications of diabetes. In this, you have to write one is diabetic retinopathy. The second one is diabetic macular edema. We have discussed both of these points in the video which has been titled as diabetic retinopathy. So please refer to that video. The third one you can mention is cataract. Now, diabetics are prone to have early senile cataracts and snowflake cataracts. Cataracts in diabetics is due to the osmotic stress which occurs because of the sorbitol accumulation. Then the fourth one is glaucoma, which is neovascular glaucoma. There is neovascularization of the iris, the condition known as previous's iritis, leading to obstruction of the aqueous outflow and thus increasing the intraocular pressure. Then the fifth one is cranial nerve palsy. In diabetics, there is microvascular ischemia that affects the third, fourth, and sixth cranial nerve, and that leads to the nerve palsies. Then the sixth one is refractive changes basically. There are changes in the lens hydration because of the fluctuating sugar levels in the diabetics. They can have hyperopia or myopia. These are the complications that you have to mention in a diabetic patient. Now, other than that, a question has been asked regarding guidelines for screening of the eye disease in diabetes. In that, for type 1 diabetes mellitus, within 5 years of the disease onset, eye examination should be done, dilated and comprehensive eye examination ideally. In type 2 diabetic, it should be done at the time of diagnosis only. At that time, if there is no retinopathy, then repeat examination every 1 to 2 years. If retinopathy is present, then annual examination. And if it is a progressive retinopathy or sight-threatening, then more frequent. How frequent depends on the stage of the retinopathy, and for that we have discussed it again in the video of diabetic retinopathy, so kindly refer to that video. One more question that has been asked regarding this topic is significance of diagnosing retinopathy in a diabetic patient. In this, you can write down the following points. So the first one is basically presence of a diabetic retinopathy indicates systemic microvascular damage in the patient. That also indicates that the patient is at increased risk of neuropathy, nephropathy or cardiovascular disease. So you will screen the patient for those things also. Then the second one is if you identify early and classify the patient early into PDR or NPDR type of retinopathy, it is beneficial in risk stratification for the vision loss in a patient. The third point you can write is since you are able to identify early, you can intervene early and you can prevent the progression of disease to blindness. Fourth one is it can work as guidance for glycemic and BP control in a patient, because progression of diabetic retinopathy is directly linked to the poor glycemic control. Thus, it will encourage the patient for an aggressive control of blood sugar levels, HbA1c, BP and lipid level control. That will also slow down the disease progression. The fifth point you can write is that advanced diabetic retinopathy can lead to vision loss. What that does is it affects the daily activities, it affects employment and the mental well-being. Thus, early detection and early management preserves vision, which helps maintain quality of life. You can break them in these points and write under the heading of significance of diagnosing retinopathy in a diabetic patient. That's all for diabetic retinopathy. Thank you so much, and I'll be seeing you in the next video. And also, I would like you to kindly subscribe to my channel to stay updated on these topics. Thank you so much.